Good afternoon, everyone. We're going to commence the day now. Thanks very much, and welcome to the Research Symposium on New Frontiers in Health Literacy and the launch of the Health Literacy Lab at the University of Sydney. My name is Joel Negin. I am the head of the School of Public Health at this university. Thank you very much. Sorry? I can certainly do that. That one? Or is it that one?
That one. And what?
I can speak louder as well, or is that? Yeah, we got it? Okay. Yeah, sorry about that. Thank you very much. So welcome to the Research Symposium on New Frontiers in Health Literacy and to the launch of the Health Literacy Lab here at the university. My name is Joel Negin. I'm the head of the School of Public Health here. Before we begin, I'd like to acknowledge and pay respects to the traditional owners of the lands on which we meet here, the Gadigal people of the Eora Nation. We are very proud and honored to continue traditions that have been going on for tens of thousands of years of education and learning on these grounds here. And Victoria Park, just next to the campus here, has been a site of learning for thousands and thousands of years. And so continuing that tradition is something that is core to the values of the University of Sydney. So we're gathered here to discuss health literacy. And I'll leave that to my esteemed colleagues, and particularly Professor Kirsten McCaffery, who will talk to you more about the Health Literacy Lab and the work that it does. But I just wanted to share, and I'm hoping there aren't any people who will be offended by this in the room, so we'll see if anyone walks out on me. But we had the New South Wales Minister of Health, Brad Hazzard, here at the university a couple weeks ago to talk about public health. And part of the preamble was saying there's not as much happening in public health as we would like. And the minister said, that's wrong. We are spending tens of billions of dollars in building new public hospitals. We are spending $1 billion on Westmead and $1 billion on Nepean and $1 billion on Liverpool and $1 billion on Randwick public hospitals. So we are supporting public health. And the audience, which was made up of people from the Public Health Association of Australia, all kind of did some of that. Don Nutbeam, who I was sitting next to at the time, muttered some obscenities. And that was the...
And then we left.
And we did leave early, yes, that's true, actually. And that fundamentally, to my mind, misunderstood the challenge that we face, not only here in New South Wales, but across the country and indeed around the world with health services. We can continue to build as many hospitals as we want, but those hospitals will continue to be filled with people. Aging population, increasing population in our cities, these hospitals will be full. Just like when we build new roadways, they will be full of cars as well. There's direct parallels there. So one of the core values of the School of Public Health is around prevention. We want those new hospitals to close. We don't want new hospitals. We want the New South Wales government to say, we're deciding to close these hospitals because there's no longer the demand for that tertiary care of services. Now, I'm not sure if that'll actually happen, but that's certainly a vision that we can aspire to. So a lot of our emphasis is around prevention, keeping people out of hospital. And when people are entering into the care system, that they enter it at the right time, get the care that they need, and are able to figure out who they should be seeing, what they should be doing, and how. And so poor health literacy is something that is core to the mission of the School of Public Health. It is one of the foundation stones of what we're trying to do within the school to improve health services and to prevent ill health. That whistling comes from the doors. It's not my teeth or anything. So 60% of Australian adults have inadequate health literacy. And there's lower health literacy, most common among socially disadvantaged populations. And so we address this through our actions in community health, in social justice, and particularly in communication, which is what the health literacy group within the school does so well. And as a head of School of Public Health and someone who's lived in Australia for 11 years, I still find every time I go to see a health practitioner, I don't know how much I'm paying, how much is out of this card or that card, what exactly they're telling me to do next. And if someone like me, who I like to think of myself as relatively well-educated, relatively savvy, I should be someone who knows how to navigate a health system, but I find it still challenging after 11 years. So if I find it challenging, the people that we work with out in the community do as well. So this is a massive priority for all of us and a massive challenge. The Health Literacy Lab, which is a wonderful group within the school, builds on foundation stones that have been going on in the school for many, many years, particularly the screening and test evaluation program that Les Irwig founded and led for 15 years. And this is that tradition and that strength and that excellence being continued into a next phase. So I'm very excited today to launch the Health Literacy Lab. It is one of the flagship programs in the School of Public Health now and will be for a very long time because they've developed this fantastic group of early career researchers who are some of the most dynamic and passionate members of our school community. The formal launch coincides, and some of you might have been involved with this yesterday, the development of a health literacy hub with our partners at Western Sydney Local Health District. And that's a community of practice committed to improving health literacy in Western Sydney. So these two pieces, the Health Literacy Lab within the school and the Health Literacy Hub within Western Sydney, are leading practitioners and thinkers and evidence providers in this space. And so this opportunity today to hear more about the work that is happening is very exciting for all of us. So welcome all of you today. I hope the session goes well. I want to particularly welcome our visitors, Professor Prothero, Pash-Orlow, and Osborne from the US, UK, and from faraway Melbourne as well. Thank you for joining us and looking forward to our discussions today. For the next bit, I would like to introduce and welcome the director of the Health Literacy Lab, Professor Kirsten McCaffery. Thank you.
Thanks very much, Joel, and thank you for your support in the school. It's very much appreciated. So, I'll just get up my slides. So, firstly, this was to remind me to say welcome to you all, and thank you. There are many familiar faces out there and also new faces, and I'm really delighted that you've come to join us this afternoon on this occasion to both launch our Health Literacy Lab and also to think about new frontiers in health literacy research. But what I wanted to do in this opening session was first talk a bit about the lab. Let me get the right clicker here. To talk a bit about the lab and then to talk about health literacy more general and lead us into our programme of international speakers and for the rest of the day. Before I do that, I'm reminded by Danny that I should also quickly tell you where the fire exits are. You can see the green signs here, and up at the back. I feel like an air hostess suddenly. The toilets are outside on the left, and the keynotes are going to be audio recorded and I think videoed, and they will be put on our website, so we'll be able to share those, and that can be shared more widely. I think that's it. Danny, did I forget anything? Right. Okay, well, I will continue. So, is that working? Where do I point it? You can just click.
You see escape.
Oh, okay. Oh, sorry.
Try it.
Okay. Here we are. Okay, great. Here we go. So, as I said, I'm going to launch the Sydney Health Literacy Lab this morning, and then the aim of today was also to learn from our international and national colleagues about developments in health literacy in their parts of the world, and then also to consider where we should focus our efforts in health literacy research in the next period. So, a bit of background about the lab. We are a group of behavioural scientists. We have a new website which we're very excited about and took us an enormous long time to develop. Please look at it. We're based at the School of Public Health, but we have expanded a sister site out to Westmead. This is a photo of us. We couldn't get everyone together in a photo, so it's a bit like herding cats in my group. I don't know about you, but anyway, this is us. We're about 20 strong now, and we're a collection of social, behavioural and cognitive scientists with a passion in health literacy, health communication, health inequalities, and also a passion in science and evidence. And the launch today, as Joel highlighted, coincides and was also triggered by the launch of the Western Sydney Health Literacy Hub and Community of Practice, which represents an attempt to really improve and address the problem of health literacy in a systematic way in Western Sydney Local Health District. And that initiative is led by Don Nutbeam, and they too have a great website which was launched on Friday, which also I highly recommend you have a look at. And our aim of these two groups was really to partner and to bring together the research with the health staff, the consumers, the community, to bring research together with those at the coalface of health literacy to develop and test new strategies, new solutions, to understand better the problem of health literacy in partnership. Often as researchers, we can get stuck in the ivory tower. And also often at the coalface, people are doing fantastic things, but they don't get evaluated and they don't get shared beyond that small arena. So our attempt of bringing both the lab and the hub together is to address some of those problems. Now, before I go on, I just wanted to give you a sort of brief history, really, of the Health Literacy Lab, which might explain a bit about who we are and what we do. So, I first became interested in health literacy when I was an undergraduate in Scotland, working in Edinburgh with intravenous drug users. And then in my PhD, I worked in Glasgow, in some of the really deprived parts of Glasgow. And there, for the first time, I saw people living in enormous poverty and saw how the health system was utterly unable to help people who lived in these kinds of circumstances. I then did my PhD at UCL, at University College London, in Professor Michael Marmot's department, who's famous for his work in health inequalities. And of course, this couldn't help but be instrumental into my thinking about health and social class and social inequality. I then moved to Sydney, where I was fortunate to meet these great thinkers, Professor Les Erwig, Professor Alex Barrett and Professor Lyndall Trevena, who introduced me to the construct of shared decision-making. And this is a health psychologist who was typically used to being very good and clever about telling people what they ought to do and how they ought to do it better. Suddenly, that was turned on its head, and I was taught to think about how we can empower people to express their needs, express their values, express their choices, to help them make an informed choice rather than actually tell people what to do. And that was really a new way of thinking for me. But what I realised as I worked in shared decision-making was that at that time, there was nothing in shared decision-making, or little in shared decision-making, that was addressing the needs of those people that I'd met in Scotland, in Edinburgh and Glasgow. And so I then was fortunate enough to meet Don Nutbeam, who introduced me to the construct of health literacy. And this is where I found my home and my research community. And then I met Jasse Jansen, who's a cognitive psychologist who was working in the area of health communication and shared decision-making with older adults. And together we combined our efforts and started the process of building our group and our lab up, and to where it is today, to this group of 20 passionate people doing really interesting work, both at the School of Public Health and now growing out at Westmead. And the aim of our group really is to bring those latest developments in behavioural science to health literacy research and practice, and to rigorously test new interventions, new strategies to address health literacy, and really with a focus on creating a body of evidence to reduce the burden of low health literacy that can translate into practice. Because if good things happen and they're not shared and they're not published and shared, then they get lost. So we want to help those great innovations become part of the literature and part of our evidence to move forward. This is an overview of what we do at the Hub. So we do research, we have education, we work across the lifespan, we have work in health information, shared decision making and self-management, and we do T1 to T3 research. But I think this quote perhaps sums up better, actually, what we're really passionate about. I think this is a great quote. It says, "Tell me and I will forget, show me and I may remember, involvement and I may understand." And we're really passionate about involving consumers and patients with lower literacy, involving them, empowering them, and helping them share decisions and share and participate in their health. And I think that might set us apart from other groups working in health literacy internationally. So the aim of the lab, in conjunction with the Hub, was really to build up our collaborative research projects in health literacy. So I said, working with those people who are working at the front line. We have a range of projects which exemplify these kinds of collaborations. So we work with TAFE on a health literacy education program. We work with Health Direct on a Teach Back trial. We have a collaboration on a parenting program with Western Sydney Local Health District. We have a chronic kidney disease health literacy app, and we're working on a diabetes app, and we have a whole series of projects around this diabetes app with Western Sydney's Diabetes. We also have a strong interest in high-value healthcare and reducing overdiagnosis and overtreatment. We're working closely with Wiser Healthcare to maximise high-value care and minimise low-value care. And we've got a range of projects on this topic which relate to deprescribing in older adults, interventions to increase question asking for choosing wisely questions. We're looking at the impact of disease terminology in adults with different literacy levels. We're looking at how you can improve communication when screening programs are changed. And we're also doing work in cardiovascular risk communication. And actually we have many, many projects, but these are just a few that I wanted to share with you. But I wanted just to go back, take a step back a minute and think about what is health literacy. I'm often asked, and I still do struggle a bit answering that question. Most simply, it can be thought of as the interaction between an individual's health literacy skills and capacities with the demand placed on that individual by the environment. And I still find this model, Don Nutbeam's model of individual health literacy, as the most, as the clearest and most coherent model of individual health literacy that I've come across. And I don't say that just because he was my boss, because he's a big cheese, but I actually really find this useful. And he is all those things. And here you're probably familiar with this model, but at the base is functional health literacy. So that's the reading, writing, oral, numeracy skills that we most commonly think of when we think of literacy. Then at the middle layer is communicative and interactive health literacy, so those are the more advanced and social, cognitive and social skills. And then at the pinnacle, I guess, is critical health literacy, and that's the ability to analyse, act on information, make informed decisions, and be empowered about your health. And I guess what I've typically focused, and research typically focuses on that functional level at the bottom. And what I'm increasingly finding or feeling is that I think we need to perhaps flip this model on its head and address and focus more on critical health literacy as the foundation. And maybe here we could focus our efforts on empowering our consumers and patients to ask questions, demand more, explain and express their needs and preferences, and demand more from their healthcare providers. And this slide is really just to highlight to any policymakers in the room who might be in control of budgets, I'm not sure if there are any here, and remind you all that health literacy costs billions. It costs billions every day. In the UK, it accounts for between 3 and 5% of all healthcare costs. That's between 5 and 8 billion Australian dollars per year. Unfortunately, we don't have good Australian data on this at that level. In Australia, we do know that individuals with lower health literacy have increased out-of-pocket costs between $143 and almost up to $8,000 per year. And of course, we know that the cost to health and quality of life is huge. But what are we doing about it? And this is not enough, I guess I want to say. And we still have a major problem. We have a high proportion of the population with inadequate literacy, and we have a health literacy environment which is far too complex for the vast majority of our population. So, what can we do? Well, I was thinking, you know, if low health literacy was a disease called cancer, would we respond differently? I think we would. You probably know that Nixon declared a war on cancer in 1971 and poured billions and billions and billions of dollars into research. And I feel that's what we need to do with health literacy. And I guess I'm driven by, what we see in this figure here, and I think many of us in this room are driven by, is what we see as the inequity and the lack of social justice, and that the fact that we leave behind those who are most at risk, and we're increasing these health inequalities, and as our health technology gets better and better, that we risk that the gap gets larger and larger. But I strongly believe that moving forward, collaboration is the key. And this is part of what we're hoping to achieve today. And with the lab and with the hub is better collaboration with consumers and patients, with the clinical workforce and researchers from different disciplines. And of course, policymakers. And so I'm optimistic that we can make a difference. And again, thank you all for coming.